Shawabi. Hey, and yen Samerson Yakusika from Parliament Crash Media, so when he saw a catcher, and more Dunemo Shamye. I saw Bubuapana Yaramo Quantra for Domia to a son cratu a dance I return and each of yourself and any Nation Coupon or share in crack, in crow, cronketua, I can see a mansi, a manta, a manamanamuno, or you are bad best Yakuko drew for why you now quiet to me posso, and with him what Shiana Bomafonam to quiet Samba Fiabaraco, or Banimonia for a dinner Nimoniam Tijaha, near dim forward to Sumutu a once actually, Chan quiet China and Sunny at Diaco, a boom water prampet to system to a son of your menu, or snag in a chair and should have. We see when you must have some quite, or back a gas and rangan and I can assess the Bantinivisi. Pram one serena, Papa so upon master and more than a year. I see Niba, I see need the second, the second crop. I depa abena at Jobwa, doing snow was fair breathful. Someone see our funny one man, I will real one. Good evening. Abra, why you put my pamo? At the palm of a for Barabaradia warfare drobano. I support Tony Mabosome. Me Bosome Alcono, all that boy young comma, all that treasury. Good evening, good evening. Nay, to young way awful. I want the at the passo live for Facebook. About a fair friend now, or far friend of Cossi, as I am, and say, who be a come. Can you say, in social guana and moy, and so I have far from at the pair by the train, yes, I say, Nini, no one say, yes, and one such a man. Now, one massing. Hello, my viewers and my listeners. Hello. Welcome to the Adipa Show. Today is the first program of the Adipa Show. My name is Deborah, and I have a special guest today. Her name is Dr. Deborah Obeng-Tuudah. And the topic for today is high blood pressure in pregnancy. High blood pressure, pre-eclampsia, and eclampsia. The reason why we're going to treat this topic is hypertensive disorder during pregnancy carries the risk to the woman and the baby. It's one of the leading cause of maternal death. So that's why we're going to treat this topic today. We have a special guest on this program. Today is the first program for the Adipa Show. Please stay in and tune in. If you got any question, please type your question and we'll answer your question. So my name is Adipa Deborah, and this is the Adipa Show. We got a special guest on this program, and her name is Dr. Deborah Obeng-Tuudah. And the topic for discussion today is high blood pressure, pre-eclampsia, and eclampsia in pregnancy. So stay tuned. And any question, you can just type it in. Then I can read the question and the doctor will answer you. Our special guest is Dr. Deborah Obeng-Tuudah. So stay in and tune in and listen carefully. We're going to talk about. Hello. Good evening, doctor. Good evening. We've got Dr. Deborah Obeng-Tuudah. Good evening, doctor. For those who don't understand English properly, we're going to speak English a bit, and we're going to speak a bit so that everybody have a balance. Good evening, Dr. Deborah Obeng-Tuudah. Welcome to the Adipa Show. Welcome to the 10th for honored invitation. Thank you, doctor. Before we start the program, good evening. Before we start, I think, Deborah, can you please turn your camera a bit so that we can see you?
Yeah. Can you see me better?
I can see you better. Good evening, doctor. Thanks very much for honoring the invitation. This program is called the Adipa Show. Our aim is to encourage and to motivate women and children welfare as well. So, doctor, thank you for honoring the invitation. Please, before we start the program, a lot of people don't know Dr. Deborah Obeng-Tuudah. Can you please give us a brief background of yourself?
Hello, everyone. Mpachomichio bia uti Adipa ye kabrofo ni twi na afra ana mebwa
na ye kabrofo ni twi na afra
no inti no michio bia enenwumre ye de yakopon asese wama ye nkwa se ye betimi ehyiemu edi nkomo inti no mpacho se na Adipa kan ye frame Dr. Deborah Obeng-Tuudah na me share me school ase ewo Ghana me call Snaps Preparatory School ewo Ghana and I me call JSS aso eka ho and I me call Every Girls ewo Ghana if you move on na me ba UK London na mbeto adison so wa ha nti ha so no me be ye levels kakra ko medical school wa ha na sisi ane de me specialty ni ye obstetric and gynecology in just say imma ho adwuma ene ye hwe nti adwuma so na ma me hia adepa na adepa me hye nkran because ye adwuma pa ebeboa ye man ye ni say fana wo fie omo ye adwuma pa ba ye nso aye wo amanone no ye boa na ye de kakra ka ho a na ni nyina esiye nti no mo ene adepa wa hya ase na meka ka ho no say me nyankopɔ adom nti me so me wo hukafo aye fe ne yaw Agyemang Gyasi ojina me chisisi a nti ona me hwe ne na me wo akola ba ko so ma me afra nti nyankopɔ adom so me be small history ni no.
Yadasi, Dr. Deborah Obeng-Tuudah. Thank you very much, Doctor. And Doctor, and the topic you perceive treaty and I know discuss this. Me perceive you motivate awofo you educate you more high blood pressure, pre-eclampsia and eclampsia in pregnancy. Me paucho high blood pressure in pregnancy and anything. What is high blood pressure in pregnancy?
See, I can't high blood pressure, dear. So, yinya fie ni friend pressure, more pressure. Na, you can't high blood pressure. Interest say, pressure na so. Na see the numbers say can one. Ye can 140/90. To be a bro 140/90. Just a blood pressure problem. Na yes, I show one simple. Na in pregnancy, no. So when you saying so now blood pressure was so saying 140/90. No, see a shame wasem amount. Na blood pressure will so when you saying your blood pressure na whole miensa. Mpacho say me country nam de brofo fra na more they are chemi because we see the thing go high uni wa the family wa. You know you know, say unyin saying na say ukohu or midwife and now doctor first say na omotaye and say you better check your blood pressure because you person you say blood pressure na will form less than 140/90. Now on my be or honma omo blood pressure dada and say no munyin say just that omunim because omo nhwe ho asem omo measure da omo nhwe ho asem nka da enti no nyin say no afa ni ebe dey because some never near checking. And oba do also onyin say ni konanim no na obenya blood pressure foforo. And you have a new onset blood pressure in pregnancy. Na no sa blood pressure ni mu ahoro mienu. You oba bia ni blood pressure na ono nkonowo ana say blood pressure na ebia na protein so e wo ni dum so mu. Into your animal, you better tell the differences between all the two.
Well done, Doctor. Thank you. Well explained. The next question is why is high blood pressure in pregnancy important? Pregnant women, just say you focus on more blood pressure. No, me midwife, I was your doctor. Why is it important there? It's just say you know why by your person educating for no say the just say you call more blood pressure. No who said DB cost you keep an eye on the blood pressure. Why is it important?
Because say when you say blood pressure here because to me cause myself blood pressure cause so utiminya tipaye nko a eche bebra utiminya stroke to me affect wa coma as well into nature utiminya heart attack to me affect kidneys blood pressure his own to me cause problems. Adepa, I say what also me.
Me pacho say.
I say what also make a plan.
Debbie, I can hear you. Me tonka. I'm say a side go.
Me side one.
Yeah, pacho to us. Yeah, take us and come on in a physical crack. By metal,
come on,
take us.
Okay. Into no, they may kind of say, into blood pressure no. Say, mommy, mommy, and checking blood pressure will pregnancy. It to me cause to mommy no. Terms of nyama can stroke, kidney problems, heart problems. So
and even
no mommy bet me aka baby. And then no pekrai no
maternal death.
Maternal death. And I say, no crap one, yes, crap na. Utumi blood pressure to me ko high ma unya bibi e friend eclampsia. Eche ni mecheche mu ye. Na eclampsia ni ye obi a on fete I so un transfer. And so all of a sudden in pregnancy because of blood pressure, no trashy. No nya ye friend be convulsion fit. And I say obana cry owo yemuno. Oh, because we blood pressure, moja ekono hono and loss bebre in terms of to me nutrients or to good oxygen. Now colano what small, you small for gestational age. So in small son that's so year.
Semi patro yeah. Me patro kasa.
Me patro. Small for gestational age. Now, 10 years, calling to me, baby. I was and your friend is still bed. And also, no, yeah, very good and no, yempe. And as a blood pressure was through baby, so Tembo honum na, as I say, deliver because it's not blood pressure and yet to me treating ye never form. Into the tembo, and I say deliver premature. And also no, and who send baby will Emma Colano. BBT says cerebral palsy, and just say learning difficulties near home down. Intimacy a treat blood pressure, and I internal blood pressure next year. Near who say a costro, near shas see a treat here, a boa woo mameno, and also a boa ban.
And a blood pressure also can cause abnormal liver enzymes, me boa. And it's me my platelets also platelet count also follow.
Ampa. It goes so blood pressure near higher. I know you quite any about preeclampsia. But and some you do honor abna. Some may cancer who or make can't be a shame near young finances ye. Say me funny say be back no be who as a midwife and I me as a doctor. You may be a trace is a woman you or be a blood pressure and see a shiny suye and I'm a boy.
Yes, the hair or trigger. When doing booking, certain things, Emma, who said this patient is likely to be a high blood pressure patient. And sometimes your urine, now you put proteinuria in the urine, and also trigger now blood pressure. Also the reading also Emma, also Emma, who said the risks involved.
Intine sa patient yi ebia wo buku no pono a wa be hu first time a wo buku no no ehona nyama wo mu a trigger nyama bi ti say when you blood pregnancy before so no be trigger no and also obi a wo kidney disease dada and also what yare be a friend autoimmune disease one want you can about SLE and antiphosphate lipid syndrome and obi or what diabetes dada until or diabetes within color baby a friend type 1 diabetes and type 2 as well the name na eso trigger and obi a no ba me blood pressure dada the from chronic hypertension it is this uncle for now more trigger it's so maybe more and simple thing I'll bet me so bit me share aspirin as see low dose because uncle for a bomb so that blood pressure no a better from now also blood supply to the baby no a baby increase
Thank
to
you.
reduce the risk na makano. Now a second group so ka ho omo de ebia na omo ni ti ye can say more than 40. Obi also a ni mood pa nti ye ka broni be ka BMI and no omo
BMI,
work
high
you say
BMI.
to BMI more than 35 and also ye hwe and ya tipa na obi also a ebia na o afi no wawo ba ne ma mi nya bi tama ne ma mi nya so nya blood pressure problem and na ne nua ba so anya bi nche se ebia na ewe busuanim nti e no so na ye se o ye den hwe ho ka and obi so nyinsen enya nyinsen ba ko nche se nkwala mienu ana nkwala miensa na e hye ne yefunu ono so na ye se o ye den keep an eye because I know blood pressure heading akoso.
Okay.
Indeed, at the back, me bad the question I will be me no, me say you check blood pressure, you check blood, you check blood, but you check blood now you perceive who in say na me can't share mu before no. The common factor is blood pressure was so me boa. You honum na ebia na blood pressure na afi na ahase wo nyinsen but ehase wedi 20 weeks onwards so na no ne friend no pregnancy induced hypertension so na sa pregnancy induced hypertension ye check wo jonso na protein ni ma ni ye check wo moja na moja nyina ye pa ni che say your blood pressure na nko na ye problem nti na no ye betimi ekipo anayon ye be ma neuro to control your blood pressure. Ebi also na but check Johnson na protein bebregu. Yeah, share protein more than 1 plus. More than 1 plus. Na as I say, we keep an eye. We also check the blood no so ebi ho no ma ye fe bibi platelets no u bleed ya and a will stop bleeding. Ebi ho na ye low. Ebi ho na liver enzymes na ko high. And then nature will say, eclampsia, which is the dangerous part of high blood pressure in pregnancy. As you see, very closely.
Thank you. After now, joining me, you need Dr. Deborah Obeng-Tuudah, or your obstetrician registrar, all educating about high blood pressure, pre-eclampsia and eclampsia during pregnancy. Into near so we're question be a patrol type in as time goes on, make me read your doctor. No, I'm also a midwife, make me answer, no, also make me assist you. Into you Dr. Deborah Obeng-Tuudah, obstetrician, or educating about high blood pressure, pre-eclampsia and eclampsia in pregnancy. Dr. Yadasi, you do third question. Who get high blood pressure in pregnancy? Who high blood pressure in pregnancy?
Adipa, and no na make a cherry in terms of obia ebianeniesi onyinsenda ebiana interfere ana multiple pregnancy ebiana ebusuani mu na mu ne maami bia na ne nuaba bi enye bida nte so mane ni ko ho so ana say ebiana yare ne wo no ho dadaw ana say ebiana o kidney disease autoimmune disease so this symptom nya mebobo ye no na ye no nti nipa sa as I say uma woni kon but nyama nyina san crofo no ye from more risk factors nti uma woni kon bo bi o ho a ese nyama bo nyina woni bi so ai bia na awoda nso eno so tumi ye den eba nti no antenatal clinic so wa unim de bia wunyin at the beginning ye hu obatan bia 4 weeks at the beginning maybe now mobile first thing you checking is you check your blood pressure now checking Jones so they will say that chassis and
you can pick it up
Indiana de bia o antenatal clinic midwives no omo check isanyama.
Yeah, that's it. Okay. Question 4. What are types of hypertensive disorder and disease? What are types? High blood pressure types and anything. I think you've repeated it a couple of times.
Yeah. And in the types in a year, obi wo ha na blood pressure no 100 down. Afei na saying onim
and
into saying Winning say so ko you booking a check blood pressure after ni apeke so into the normally no focal booking around 12 weeks or honum na after na when ya we one messing period when who say so na after na or checking or back on your blood pressure and no na dada and sana there's an name na and they do a also na maybe 20 weeks above no and sana who said blood pressure na yede into no na PIH no and PET no
pregnancy
preeclampsia
induced hypertension. Okay, thank you, Dr. Deborah. And then the obia fabi be free. What question be a patrol type? And yet easy so when Dr. Deborah Obeng-Tuudah or you're very busy doctor. Benne waba the patrol to educate us into me patrol my way in education and you're very useful. Me patrol question 5. Symptoms of high blood pressure and preeclampsia. When you say some of the symptoms, headache, severe headache. And sometimes in proteinuria, as we've talked about before, proteinuria in the urine. Into an abnormal liver enzyme. It can be some of the symptoms. Doctor, if you are
oh, sa into no ebia for the tembo ha nyama koso ho foul some styles be so ho hanom ye yakakra ni nyina obeka se ebia na yefuna wa faninti banyama bi se na woka no utitumi pa wo fa parakra enye de enko da na wo severe headache ebia na weni so mi a me she glasses yi kra wo she glasses kra ko hu so weni so ayo ye fancy kusu kakra so ana unya flashing lights and no eso o hwe ho asem na ukoni en check blood pressure emma edu also ana obofno na wo fe beginning of pregnancy no year fear wo mu de baby ne etumi twa so wo ko 3 months and above na etumi twa all of a sudden now start say wo fe wo ntia ase and also no is a sign and now say bia unfimu right side in the liver whole side and below your ribs on the right
severe pain as well.
Rib cage or severe pain as I say oh my ho asem now one thing I saw bia etias and say one of the things are preeclampsia and say ma issue age now body name all over but outside in who or 9 but 9 is very common in very specific but it's the one sa aswa na to me in show ring a crap say you run one sa aswa and now say when nim obi onimo say na it when nim aswa and we more typical of preeclampsia when nim ahon ntino ese say no so koye den o hweka and I do also na one hwe yi a unya weni mu nyina obeka so ma break akra ana ebia medi adwane bia ni me anje ana say bebre ni mu no ma bebre ye excuses because symptoms are very clear so na so akakra wo tipa wo kakra ni nyama wo ma dehydrated now we excuses but one check blood pressure one thing I will check blood pressure so blood pressure na ye high into that's very typical. But same boy, blood pressure na ebia na normal at the beginning. But I will check if you mobile say high. The first time me normal, as I say, I check if you another time just to be sure. Or baby also ebia no nya symptoms bia so and also obi wo ho no nam ofia wa nya symptoms nyina ba wa mpa nhwe obohu no watwa hwe no nya eclampsia na no so akodan na no so akoye emergency so nya eclampsia na no abandon emergency.
Okay, thank you, doctor. Patrol, the next question is what are the treatment of high blood pressure in pregnancy? Treatment I know some we need to turn urine for PCR and you just say a PET blast and sometimes you do two medications with like labetalol and the fedapine into what are the more into details let me educate you.
Good. Now, as a ma, we will blood pressure that down. Young fan say, "Mommy," and say the blood pressure problem in 3 types. So, do a blood pressure problem normally no mobile or more draw so that out. But beginning on a cell tray dry and then acolano so bearing a bed. So we draw so enye ma akwala na ese uyi ni free so na de ne to blood pressure draw so a eche na in pregnancy ye use a draw miense bi ye use labetalol ni ye use nifedipine ni ye use metadopa ni nyina depends on the no obeje obi a mefa so obi asthmatic a won't me fa labetalol ma no nti na wako nifedipine ana metadopa so nti na ebi a draw bi nifedipine so ne wonti a esi ye reverse na ni nyina na se ye ma o blood pressure medicines and when you so obefa na a reduce blood pressure less than 150 over 100 when you say meaning say me can less than 140 over 90 before but when you say yen person e be man aba from too much because they say moja no yeden efo akola no so when you say your target now is slightly higher at 150 over 100 as I say or below that so na the power can about proteinuria no any blood test and any blood test and once a can before into you know so you check it so that you check your kidneys you check your liver because I know so no effect me or blood pressure bet me affected those things and now you check the amount of protein in your urine and it gives us an idea how bad things are so into nyama no but yeah into no you need na I see you keep a very close eye on you. I see you making sure say the blood pressure is very very high and I may come very very high and may come obi and blood pressure 160 over 110 160 over 110 ni pasa no ese ujine to ho hospital ho so now woman blood pressure medicine never form now blood pressure medicine is all man of the obefa won enum na emma for matembo e say o di she o di siniso sa na meka no o di siniso na emma blood pressure never form now keep one eye so on the baby as well so share
doctor I think you keep an eye of the inputs the output as well and also your importance there obi will very high blood pressure now it cannot be controlled we need to keep an eye on the kind of say the fluid balance so
no you the unti yes and say normally nse na make kan say nsu gina baby so we preeclampsia sisi and ya call on to you feel chronic hypertension you feel hypertension alone in pregnancy without protein and now you have the more serious version which is preeclampsia with protein significant protein in your urine so na no na aya atembo na no very serious na aye kan nya
okay
say you check here because in so to me lungs mo home iodine I low
I think that the line was a bit bad, but it's okay. Hello.
Into so to me now lungs so into so to me now abdomen basically blood vessels na you can say iodine leaky into no you check your urine to make sure say moja enough echo kidneys ana because we nya enough moja echo kidneys so betimi kidney failure so and as you amount too much fluid so now to to replace the reduced fluid or blood pressure blood vessels anymore and also betimi akogina okokoso no we nya pulmonary edema so into balancing out into your check your kidney urine output now to make sure say we nya enough supply to the kidney but not too much to give you pulmonary edema and other edema elsewhere in the body into your check your kidney urine output.
Thank you, doctor. The next question I think the next question is what are the things you need to look out for? I think we've covered them, but I think we are repeating ourselves. But what are the things we need to look out for? We talk about BMI, we talk about the proteinuria in the urine, the high blood pressure, and also Yeah, and also the blood test that we do. And I'm a boy.
Question pan we be because nyamana is a chronic hypertension and pregnancy induced hypertension no protein in him. So now so what preeclampsia protein woman no a bit to me ako say you can say ubenya ye free be helps. Instead, only check your blood test and catching and I make about low platelets and elevated liver enzymes. So and I do also now blood red blood cell no and just say red blood cell as in me no moja I carry oxygen around your body no tembo honum na start to say break it down your friend hemolysis into na see keep an eye to make sure say if you are developing sana see a treaty one time now at the pa one thing I make an say tembo honum na ima or mobile with preeclampsia and ebia na akola no onyi year to 9 months no ebia na me can say or 28 weeks ebia na oba na enam 34 weeks into na no say we be deliver akola no intem and say we say na blood pressure and the way e kosro no ma me betumi enya effect. This is preeclampsia sem na making obenya effect na say utusu hu say we start a draw e be reduce the chances of her having effect. So into say odwen hu say okay say bia say me sound in addition say we manage blood pressure medicine we checking nyaminya we checking a renal output we checking the blood test ni na odwen hu say say me manage magnesium sulfate ana because woman is and the blood pressure near this high and if you are not obetumi iron a trash in your effect the magnesium no protects the brain from having effect. So and also magnesium no be develop we deliver akolano early for the mom now and also no magnesium also helps the child to prevent things like cerebral palsy till or less than 34 weeks.
Dr. Deborah, minimum say all women and you allow pregnancy in reach 40 weeks some blood pressure like especially chronic women with chronic hypertension they can go up to 40 weeks but not all women can go up to 40. And sometimes just induce you. Can you talk to us about some of the risks in here? Just I know say IGR and so forth. Can you elaborate on that for us, Pacho?
The truth of the matter, let's say, the treatment of pregnancy-induced hypertension. So, what chronic hypertension there in there who order down, but the treatment of chronic-induced hypertension, pregnancy-induced hypertension, and preeclampsia is delivery. So, because a drone, yareni starts from placenta in terms of the way akolano attach it to and none of the yareniba. So, intimacy deliver one that is the beginning of the treatment for you. So, to say, blood pressure is very, very high, name control that, and you make that decision, see you be deliver akolano. Obi ohonum sana mikai oba at 28 weeks, and the blood pressure is very, very high, more than 160 over 110. Ebiano develop a health syndrome ya mikai. So, and I ebiano onya fit eclampsia. And no, so making the decision says so deliver mameno for mameni's sake. And yes, sir, ebiana assembly I atom. And now say ebia we check his scan now we check baby na akolani sa but akolani nya enough blood supply from nena no fine yeding intend we check his scan a couple of weeks to check the same scan no baby a ujina na no yeding ujina and so in that situation so your decision is okay so we deliver akwala ubetimi ayeden ubetimi feeding wo outside and premature there but at least ubetimi ayeden bibi about it sometimes ni na depend on obenya preeclampsia no ne de ekoso to ba earlier on let's say 28 weeks na see deliver wa ye beye depending on the situation how high your blood pressure is in other situation and I'm making say a premature now as a CMA magnesium sulfate for a nano so that fit it, and also for a colano buano. This in the brain in terms of reduce the chance of cerebral palsy. And only less than 34 weeks in a cell dream for a colano. By nano at any gestation a cell dream for magnesium sulfate. Now, one of the things is why is to say we Emma akolano so that we premature crana obetumi the best chance possible no in lung maturation. So so kind now man steroids and I'm a units is all kind now man steroids to help the lungs to develop to mature so that wona ne humimuno and
even though you're premature.
Into Nina, Canitiana say, Nina is all blood pressure and you to mean controller and see a delay for your sake.
But sometimes we try to make sure say up to say a severe one to up to 34 weeks, isn't it? Sometimes. And
but you'll say, man, till you're kind.
Sometimes, a severe hypertensive women, pregnant women, we can drag it up to 34 weeks.
The main aim, say, you know, a person would do 37 weeks and above. That's the aim. But say, we hear the obit me, we do a high no you to me the tata so. Now offer na Philippine. You to me the tata so now. Yeah, admit me amount medicine through the vein. And ye do my dear, and the baby in the night, just say decision if for your life.
Exactly. Thank you, doctor. Okay, so say you're about eclampsia. Doctor, you can't eclampsia. What is eclampsia and its treatment? What is eclampsia and its treatment?
I'm say, I know my boss can be in person, and I make us some. But eclampsia and but you're okay, man, too.
I mean, it's associated with seizures, like fits and all sort of things.
Seizures. But normally, eclampsia no, happen or bar. Oh, yeah, seizure. You say, and yeah, dear one of them. Now, bar blood pressure high. Ninyama. Now, when you're pre-eclampsia, into what the symptoms, and now, yes, we'll check in as well who signs, in terms of blood pressure, protein in yama. Now, all of a sudden, we started to say we trash it, no, so no, seizure, and no near friend eclampsia, because we say is related to the pre-eclampsia. Before, when the dini crop associated, but we pre-eclampsia, just say, and sana when you're fit, and pre-eclampsia, and I see before fit, literally, and into eclampsia now, just say, oh, fit. Now, back to the treatment now. Is exactly the same, say, as surgery magnesium sulfate.
Okay,
the magnesium sulfate, and nana, the say, will brain cells stabilizing. It is a electrical firing be coswa and triggering too much. I be my way when you're fit. It is an but then more how or baby or when you're fitter or be saying you. Woman first dose, which is 4 grams of magnesium sulfate. First dose, as I said, for 24 hours to stabilize the woman. Into woman, the magnesium missing is so as an infusion. They no back 1 gram per hour for 24 hours. 24 hours, either the last time of 30 years, and I said time I will deliver. No, which one is the furthest? So, but the main treatment I make, can say. As I say, we deliver no, because we'll be effective now. We stabilizing now. We stabilizing we are. As I say, we deliver no, because we deliver now and only treatment, So
when you talk about delivery now, because of failure was stabilizing, the only unit it have to be section.
Nina depends because obia onya eclampsia no. Yankopon de ne hu ye wanwa in the sense say so onyin say no onya feta. Most of these women no. Or want them. If you're all calling in no dilating, say so taking So ebi o ha who stabilizing and now breaking the waters pa obi wusisia obi also a ebia na oye far finti nipa sa na yesa oye cesarean section just no ba bia ne situation so nti yesa wo check say titiri oba a wa woda de obetumi awo ntema ma wo say who breaking the waters so ba ni nyina wo ye ni nyina wo ye ni nyina na wo ye de na wo monitor. But see, you can't say it's a woman is less than 34 weeks there. Time when not the end there, say unim say on your close to 10. Into be a win sooner if you any juma. Into you have to think about cesarean section. Or 28 weeks there in the cesarean section. No, so
thank you, Dr. Deborah. Okay, Doctor, we are getting there. Yɛda asete ne wonyam repa ama ye ekyerɛkyerɛ ye nneɛma mu educate you me part of 59 after delivery no into postnatal care ni treatment bien na ɛkyɛ sɛ ye implement for women no obi a or go through hypertensive lady what deliver successfully. What are the postnatal care and treatment that we need to implement to put in place for successful recovery?
Maka say the cure no is the delivery, but say the cure no is the delivery, not the delivery of just the baby. It's mainly the delivery of the placenta. Into delivery placenta and is the beginning of the treatment. They are the cure, no, I would say. But as so who say hormones say fi placenta nimle wo ba ni moja ni mudada. It doesn't take all of a sudden for it to go away. So will keep an eye on blood pressure. So because one thing that you will find say a jumemuno or no waba postnatal ward no the blood pressure to me cause so even further and sana I get it better. Into your bar on the blood pressure near very severe no and so keep you at a place of being 1-to-1 care into your can either HDU and ITU into say any corner home the blood pressure no and then so we'll keep an eye on the renal output and so keep an eye on the say
you're connecting it to the monitor so that we can be doing hourly blood pressure and also measuring the urine as well, the urine output.
The urine output and there's so more when you corner. But say the blood pressure near too bad, no bet me uncle postnatal ward no a horror. And also I say every day be I'm checking blood pressure. Tembo hand me account for hourly ups and I'm every 4 hours. Now we'll check it.
Once we get to the postnatal
but the one thing I say me can do, they say normally no blood pressure na echo up very severe around day 3 to day 5. So it has that trend. Into blood pressure you high that out. You're more treatment about normal. As you're going to day 3 no high. Day 3 to 5 no is the peak, the typical time no. Now to make higher, I say timbo I di edroni bi eka more blood pressure number form and sana get it better. Internet the fact say wa won pen does not mean say blood pressure no I as you keep an eye on you. Mami wo ho.
Me patcho me wo ho.
And as our ba no ahanum krom ha no mumu midwives no ko fie echo check blood pressures and am bebo adepa.
Yeah, community midwives.
Community midwives echo fie echo check blood pressure. Titi no omo check say first day, second day, and more important, omo check day 5 to day 3 to day 5. No much into high blood pressure, omo send no to either GP and now hospital. One thing also I say uhune say wunyin saying o body ni is stressed to the limit say yarewa ewo ho no epie say wunyin saying obi wo ho otumi nya diabetes in pregnancy and also wo ho obi also onya blood pressure obi also obi also onya mental department so Nyamasano is your body trying to tell you what you have a tendency of. I.e. Yarewa ase a because we need send our body no higher stress na afe na APP into the when your blood pressure issue in pregnancy as say we show no so ye because and yes na later on in life no better ubenya blood pressure into so we show we did mu in china woody na say ba form so wo so a as say ma lose weight ma ba form and as say aduane a woody no so na say we check it so high fat meals ni nyama na say we check ni nyina in future no so that unya blood pressure and now ubenya krapo a ubetwe akọ echire kra.
Well done, well done. Inti Dr. Deborah, women with previous history of high blood pressure, no, in case of future pregnancy, no, what are the things we need to be aware and we need to educate them about? So, be aware when you have blood pressure during pregnancy before, no, it's in the future pregnancy. No, what are the things we need to put in place? And now you've just said, money, yeah, well, and now you're educating on. I know, say, because of your history of high blood pressure, and then they say, and now when you high blood pressure during pregnancy, obey on your midwifery care, be consultant led care, and I just say a time monitor the urine, and then the blood, and the BP, and DMBM, you just say put it in place.
Well, I no so here because so when you be in pregnancy, as I say, unimo internet so who midwife pana na so bosso echre because beginning they make about aspirin say enobua to reduce preeclampsia so into ye share aspirin na ase intema ebeboa ideally around 12 weeks may can low dose aspirin so 75 milligrams so ye share enobua the development of the placenta here may can say is in the middle of all of this causing the problem and no the development of the placenta. Now placenta develops between 12 weeks and 20 weeks. So core developmental period. It is offer aspirin during this time so that in future your risks and say chances of being blood pressure and a baffle. And also one thing I'm say obiati say and now say adolfo say so when you preeclampsia before and eclampsia mpacho first thing kohun doctor who say when you say na kohun doctor na keep a close eye on you. The main thing they say when you preeclampsia, let's say when you preeclampsia around 28 weeks as I say surveillance a shots your mouth. So keep an eye on the size of your baby. May find say around 24 weeks and now 26 weeks. A stressing our banner yeding any international making a ultrasound scan. And also I see a checking wow blood pressure. Normally in other women you been every 4 weeks. Baby I wanna be every 1 to 2 weeks. In just our blood pressure na shots need to make treating in them. And now it depends on time when you preeclampsia. So chronic hypertension, pregnancy induced hypertension, the same goes for it as well. So let's say around 34 weeks so now but obia or less than 28 weeks, or risks of getting it again, or risks of getting it again about 50%. It's 1 in 2. So in the end, I see people around. So who will preeclampsia bar before 34? Now who before 34? So 34 weeks. Or risks of getting it, can be 1 in 6. So when you PIH so risk of getting it can be 13% in terms of preeclampsia. It depends on the severity. But either way, when you're before, it's likely to come back. Keep an eye. Near starting aspirin in them, near check your blood pressure regular, near control with medicine, and I also near scan for a colano to check how the baby is growing. So I just say.
Thank you. It's an honor, it's a privilege. Say, Dr. Deborah Obeng-Tuudah. our educating about high blood pressure, preeclampsia, and eclampsia in pregnancy. I know so be a famua at the abundant to man, so wabusiani and now maybe I will be a baby na coswa, one who symptoms now, so when you clip will be a patrosema unia. When what me a doctor and tell am I check you and today because the aim of this program is say we want to educate and kind of say promote and motivate people to change their perception about their health. Nti they will see a piano onuya fa bomb to man na fa ye bibi fa change your be abrabo ewo wabusia mu. It can be your family member be no nyinse kwa na na ho a enka se bia o e bema wo say yeah, Africans, your perception so now that is oh obewo bema en patcho mo bia nyensa ko obewo bema nye bema ntina ne na aso aso no ebia na wonya preeclampsia ni bi ntina watimi amaye de na hospital na nimu ye porphyrios bema na onyim na wa ntina wa hono ta no and ntina the high risk of maternal death in Africa and about high blood pressure very high no you take nyeme bia say bema na unyinsɛn tina why puffy na so na wo so and Dr. Deborah Obeng-Tuudah wa educate about this topic only from one ba afa born to man so nim say na edin wo adipassion so what do you say to Dr. Yeda say I mean that time o spend it don't so or support to ye nyame sha ne pa ye da baby so as say onya time o ka na no tuba wen so a one how adwe e ma uti if ye da family
Oh,
na
I said madam I also say so maso ye baby mu omo no maso ye bani mu dia na wa ma ye kwan ama ye timi dia ye.
Oh, that's nice. Yeah, that was daddy ni mommy. Nyami shamu. Dr. Deborah, you best time invite to back that the passion be as time goes, maybe 2 months and 3 months time. Now what's about educating about maybe different topics because and be call a chile pass saying you be change your perception about nyama be because blood pressure in pregnancy who are it's the high it's like that it's the leading cause of maternal death. It's a no obedient clip here. The leading cause of maternal death because ye be before no so na ye se obe wo bema enye bema na obe wo ebia no wonya preeclampsia mo ma ye ntiti e bedu na ye se okwa awo so a wo amba nti program we doctors nebeba so sometimes midwives beba so health professionals beba so we want to make an impact if you see you changing your perception you be before no you change you make impact with Ghana you make a difference me no Ghana ye dia into onua so we be nya adventure na person ba at the passion so betimi I inbox me any question obi or question be our person Dr. Deborah Obeng-Tuudah answer na wakwa na actually so question be obetimi I inbox me the next time obeba show no so you betimi be amana na metimi answer question na Doctor once again ye da wase nyame nhyira wo ye be say invite you bye bye thank you bye
Bye.
bye.